Hello, and welcome to a summary of the Health and Care Staffing Scotland Act 2019. I hope to give you a brief summary of the legislation to help you know the principles of the Act and the duties for care services and for the Care Inspectorate. We have a variety of resources available on our Safe Staffing Hub page, where we have links to the legislation, guidance, and learning resources. And we've developed this session to enable you to easily access information on the Health and Care Staffing Scotland Act. The format can be used to share information with people experiencing care, their relatives and carers, as well as a learning resource for teams. The Health and Care Staffing Scotland Act 2019. The Scottish Parliament passed the bill for this Act on the 2nd of May 2019 and received royal assent on the 6th of June 2019. It's an Act of the Scottish Parliament to make provision about staffing by the National Health Service and by providers of care services. The guiding principles state that the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best health, or, as the case may be, care outcomes for service users. The term service users used within the Act, but will refer to people or people experiencing care, which will include adults, children, young people, and infants. The legislation will be enacted on the 1st of April 2024. So what does this mean for care services? The Act identifies that care services have the duty to ensure the provision of appropriate staffing. People's care needs should be considered when making decisions about staffing levels and skills mix. Care should be appropriate for the health, well-being, and safety of people experiencing care. Staff should be in the right numbers to ensure the provision of high-quality care. Staff must be trained and suitably qualified in their roles, and also the well-being of staff. So at the introductory stage of the new legislation, the Scottish Government have not imposed specific staffing levels, but will encourage the development of staffing methods that enhance outcomes for people and ensure the well-being of staff. So when determining what constitutes appropriate staffing levels, care services should consider the nature of the care service, the kind of service they provide, the size of the care service, the aims and objectives they're working to, the numbers of people experiencing care, and the needs of those people. So what does the enactment of the Health and Care Staffing Scotland Act mean for the Care Inspectorate? Chapter 3 of the Act states that the Care Inspectorate has responsibility to develop staffing methods for care home services for adults and other services as the Scottish Ministers specify. Collaborate with a wide range of stakeholders and social care sector representatives in developing the staffing methods, and to have regard to the guiding principles of the Act and any guidance provided by the Scottish Ministers. What's a staffing method? It's a combination of factors that either must or may be included when care services are making decisions about staffing to ensure that staffing levels and skills mix are right in care services. In the first instance, staffing methods are only required in adult care services, but this may change into the future as the Scottish Ministers determine the scope of the legislation. The legislation states that staffing methods used to determine the appropriate staffing levels for a care service must include the use of a staffing tool. Most care services use some form of dependency tool to determine staffing levels. This tool must be designed to provide quantitative information based on people's needs, as well as quantitative or qualitative information related to professional judgment in order to assist the care service in determining the appropriate staffing levels. The legislation also states that staffing methods may include that the care providers put and keep in place risk management procedures, the current staffing levels and any vacancies, the local context of the care service and the physical environment, any assessment of the quality of the care service, the needs of people experiencing care, as well as their views and that of their family or carers on the staffing method. Comments from staff may also be taken into account, as well as other healthcare professionals. The staffing method may also include any changes in guidance or research. So as we know, the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best healthcare, or as the case may be, care outcomes for people. Staffing for care services is to be arranged whilst improving standards and outcomes for people, taking account of people's particular needs, abilities, characteristics and circumstances, respecting the dignity and rights of people, taking account of the views of people and staff, ensuring the well-being of staff, being open with people and staff about decisions on staffing, allocating staff efficiently and effectively, and promoting multidisciplinary services as appropriate. We hope you found this short summary of interest. If you'd like more information on the Health and Care Staffing Scotland Act, or to access links to guidance, programme information or resources, please click on the link to the Safe Staffing Hub page, or alternatively, email the team with any requests for information or support. Many thanks for your time today. Please follow the link to a short survey which will help us to develop our information into the future. Thank you.